to you a bit about what Kaiser is doing around member-facing personal health record. So I think you're all aware that we have implemented a system-wide electronic medical record over the last 4 years. What we've also been doing is looking at what the patient-facing version of that is. So we make a distinction between the electronic medical record, which is really what the doctors use in the clinical setting, and what's visible and usable by the patients as they are working with our system and with our both administrative and healthcare entities. So we find ourselves in a situation where realistically consumer expectations are different. They're different about what the healthcare system provides, in part because the rest of their world has been changing while we've stayed fairly static. So they expect us to give them choices about how to interact with us, choices about what times they can interact with us, what mode, whether it's telephone, in person, or by computer system. They expect us to be efficient, not just because increasingly they're bearing a portion of the cost, but also because it's their time. And so they expect us to be respectful of that and pay attention to what works for them in terms of time, not just what works for us. They're also expecting us to be focused on self-service. Everything that they do in their lives pretty much is about self-service. So I've got a picture of a grocery store where you can do self-service checkout. But think about the kinds of shopping experiences that people have on the internet. Think about what they can do with their banking on the internet. They're expecting us to keep a pace with those kinds of capabilities. And they're also expecting us to be able to provide multiple channels to serve them. So whatever works for them for a particular interaction, they want us to respect that and give them the alternative. So in short, we kind of think that their question to us is, why can't healthcare be as simple as shopping? So the way we are responding to that is a variety of ways. Certainly our implementation of the electronic medical record was all about making us efficient in the delivery of clinical care, making us able to use the data at our fingertips in a variety of settings, to be efficient in passing information between clinicians. But we also think it's about providing them with the information that we have. So it's not just a medical record that we own and that our clinicians have, it's theirs as well. When we started to do this work, one of our first principles was that the medical record needed to be transparent and that it was a shared medical record. And that wasn't exactly a straightforward message to inculcate into the organization. We were used to thinking about our members in a kind of paternalistic way, that we had the information about them and we'd share what they were able to handle. Over the past 5 years, as we've made this shift to providing more and more information online, what we've really been able to see is that informed consumers are actually better partners for our doctors. They're better able to participate in their own care, and they're better able to ask questions, educate themselves, and come to the table with things that will actually help them work better to take care of themselves. We also started out with a lot of features that were about viewing your record, so that we were sharing what we already knew about them with them. But over time, we've come to believe that for a personal health record to be successful, it can't just be passive. It can't just be something that you look at. A historical record of your health care is probably about as useful as your old tax records. Now, every once in a while, you want to check in and see what happened in your taxes 3 years ago. But most of the time, it's really about your finances in the moment. So we're looking at a variety of tools that also allow people to take action about their health care. And these are the kinds of areas that we're really planning to expand as we go over time. So people on our site can not just view their lab results and they can see a record of their past office visits so that they can actually remember what the doctor said to them, but they can also refill prescriptions. They can make appointments. They can email their doctors and expect a response within 48 business hours. They can educate themselves. We're trying very hard to use the teachable moments when they've just seen a lab result that tells them something about a condition that they have, to not only provide them with education about that condition, but also to provide them with tools so that they can make behavior changes. So that there's really a surround for them of how they can interact with the system and how they can take responsibility for themselves. So the real bottom line here is we're successful if they are able to not only experience us as convenient, but to actually be better able and better equipped to make changes that will help them manage their own health. We've got some pretty good numbers here to tell part of our story, is that people really are using this record. So if you read some of the literature about personal health records, the skepticism is about whether people will actually use those records. In our experience, if you provide them with compelling information and a compelling surround, they indeed do use those records. So out of our 8.7 million members, more than 2.4 million have activated on the site. And last year, 60% of those activated members went in 5 or more times. So it tells you that we've got some something going on in terms of people actually using the records. Every month, more than 500,000 messages across our system are exchanged with their doctors. And one of the things that has really started to show that this is making a change in behavior is that the doctors are initiating messages out to patients. So last year we saw almost 10% of messages were started by the doctors, not by the patients, and that's a real transformation as well. We have every month nearly 500,000 visits to educational resources. Those include our health and drug encyclopedias, our featured health topics where we teach them more in depth about their health care, where we offer videos, and also behavior change programs where they can actually online learn about nutrition, take action to manage their weight, learn about caring for a chronic disease. We release about 36 million test results a year, and last year 10 million of them were viewed online. This year we've already surpassed that 10 million, and we're on track with about 1.4 million visits to lab results a month to exceed more than 12 million. And nearly 300,000 prescriptions are refilled monthly online. So those are things that start telling you that people's behaviors really are changing. This is some stats from our weight management and behavior change programs. We have a whole series of web-based interventions, but what we're seeing here is that people really are using those programs to make changes. Now, we're not getting the kind of numbers to these programs that we'd really like, so we're looking at ways that we can do a better job of presenting these programs at those teachable moments, at the intersection of when somebody is ready to make a change, to inform them that these are available to them. And we're starting to see some results. Results that mean that we are more efficient and that our costs are going down. So people who use email look like they are 7 to 10% less likely to schedule an office visit, and they make about 14% fewer phone contacts with the system. We also see that people who make their own appointments have about 50% lower no-show rates than people who either call or have appointments made for them by the system. We're seeing cost savings across all of those dimensions. This is one of those great spots where things that reduce our costs actually are pluses for the members and feel like more convenience. and that 97% of the members who are using the online services are either satisfied or very satisfied with what we're doing online. So the bottom line is we've got a ways to go yet on making these services even more available, learning more about the teachable moments, but we are on track to make healthcare equivalent to that shopping experience in terms of ease, ability to get it in whatever mode they want it to be delivered on, and responding to their needs rather than being focused on our needs. We think there's a way to go, as I said, but we think we're well on the way. Thank you.